New developments tonight in the race for COVID-19 vaccine to talk about. The United Kingdom, now the first country in the world to approve Pfizer's COVID-19 vaccine. Leaders announced today that Britain's National Health Service will start administering Pfizer and BioNTech's vaccine early next week. The UK has ordered enough for 20 million people, but it's not clear how many doses will arrive before the end of the year. And tonight, more hope for one here at home. The CEO of BioNTech says a vaccine in the U.S. isn't far off.
I'm confident that an authorization in the U.S. could also happen within the next 2 weeks.
The U.S. has scheduled a public hearing on December 10th to discuss the Pfizer-BioNTech vaccine. And as we await that approval, a lot of you have been calling and emailing us asking if the vaccine is safe, who will get it first, and will it be free? This week, the CEO of our area's top hospitals, including Atrium, Novant, and Iredell Health, addressed those very questions. WCNC Charlotte's Ashley Daly joins us now with more.
Once the vaccines arrive here in North Carolina, the governor says they'll go to a select number of pre-identified healthcare providers, including Atrium, who will then lead the charge on distribution. In less than 3 weeks, just under 85,000 vials of Pfizer's COVID-19 vaccine expected to arrive in North Carolina. In Charlotte, both Atrium and Novant say they have the specialized ultra-cold refrigerators needed to store them.
We have refrigeration units that can store on day one 300,000 vials.
So who gets the vaccine first? Healthcare workers on the front lines.
And I would anticipate by the end of the month that we are immunizing people in the Charlotte area.
By January, the state says they hope to begin vaccinating the most at risk of severe illness, including those in assisted living facilities. Then by this summer, doctors are hopeful the vaccine will be available to the general public. How much will they cost?
The COVID-19 vaccine will be free.
And with the vaccine soon available, doctors say their biggest challenge now is educating the public that they're safe, saying the vaccine will only be effective if a large part of the population, or roughly 200 million people, participate.
I think people have this sense of, well, they just pulled this out of their hats 6 months ago and they ran it through some people and they're going to rush this through. This idea of mRNA vaccines has been around for a number of years.
Doctors say the COVID vaccine will require 2 doses and, similar to the flu vaccine, will likely be needed every year. And despite misconceptions, doctors say the vaccine will not give you the virus, but could ultimately save your life. Reporting in Charlotte, Ashley Daly, WCNC Charlotte.